I just want to take a couple of minutes to talk about healthcare in the Middle East, GE Healthcare and Healthy Imagination, and what our activities are in that. I'm sure you all know, and this is one of the points of the discussion, is going to be about the healthcare trends in the Middle East. To talk to you briefly about it, I mean, there are certain challenges in healthcare in the Middle East, and they focus on a couple of things. First is healthcare access, number of hospitals, specialized or rural. Second is the funding system. They're building a sustainable funding system. And the third is clinical expertise. If you look at all the different statistics that are available, and with some of the studies that came from McKinsey, I mean, the expectation is within the GCC by the year 2024, the healthcare spend will grow fivefold to $60 billion. There's also an expectation that the healthcare demand during that period will rise by 240%. So you can imagine the challenges that the healthcare systems in the regions have. As GE Healthcare in the Middle East, we have been in the region for about 25 years. And our approach is the same as the challenges that the region has. One, we're talking about assisting in healthcare delivery, training, clinical education, and partnering with such institutions, public or private, like Sulaiman Habib. But the one thing I'd like to take a couple of minutes to talk about is the Healthy Imagination business initiative that we have. The Healthy Imagination business initiative that we've rolled out about a year ago is similar to the Eco-Imagination initiatives that you've heard about. It's actually a $6 billion investment into healthcare. And the key in that is to look at three aspects of healthcare. One is increasing access. Second is reducing cost. And third is about improving quality and efficiency in the healthcare system. In Saudi Arabia, and with our strategy, Healthy Imagination, and with the challenges that they have that I mentioned earlier, you could see the synergies that we have in this area together. And some of the things we've already done, like we signed an MOU with the Ministry of Health in Saudi Arabia about training. We have trained about 1,300 healthcare professionals from the MOH since April 2009. We have signed this MOU to continue this program, and we're talking about full-blown programs for a number of years, internal, external, clinical, healthcare leadership. We've also worked on 8 hospitals where we've worked with them on OR efficiency, looking at reducing costs through efficiency planning, using the GE tools to be able to drive those forward. And what we're looking forward to is some more partnerships that we're looking at. And the other part that's more important that we're very proud of as GE Healthcare is the Healthy Imagination outreach to the consumer. And I think this is the critical part that we're doing in this region. This is purely focused presently on Saudi Arabia. We did a study on consumers. And what we've realized, what we've seen from the data, is there is a discrepancy or there is a gap between what people think of their health and how their health actually is. As an example, I mean, some of the challenges that we have in the regions are obesity. And there's a thinking that obesity doesn't have a solution, or cardiovascular diseases are incurable. This is actually not true. And we believe that part of our mission in this region and giving back to the region is to work together with local institutions on building this awareness. And what we're launching is Long Live You, the Healthy Imagination campaign to the consumer. You'll see it in digital format and online and social online format. And what it is, you'll go at the website called www.healthymagination.me. It's a website in Arabic and in English, where there'll be advice, and you'll see also we have healthcare professionals that will be able to help you as we go forward.